This is the 2-minute warning. Reporters on the line can press 1 to ask a question. Thanks.
Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services, and I'm joined today by Director of Emergency Management Mike Sprayberry. Lee Williamson and Monica McGee are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. I'll start with a rundown of the numbers. As of this morning, there were 172,209 laboratory confirmed cases, 1,656 were new cases since yesterday. 858 people are currently hospitalized, and sadly, there have been 2,803 deaths. In the many briefings we've have done on COVID, you've heard me place a strong emphasis on wearing face coverings as a critical piece of the 3 W's: wear, wait, and wash. And you've heard about our work to identify and reach North Carolinians who are at higher risk and need support, especially members of historically marginalized populations in our state. Today, those strands come together in an exciting new way as we launch North Carolina's new Whatever Your Reason campaign. It's a statewide public campaign to encourage every North Carolinian to wear a mask in our collective fight against COVID-19. Now, I'm really excited. First time we're doing this in our press conference, I'm going to premiere one of those TV spots that we'll be using to get this important message out. It features real people in North Carolina explaining their personal reasons why they choose every day to wear a face covering and do their part to stop the spread of COVID-19. Let's watch it now.
You can't know someone has COVID-19 just by looking at them. Anyone can get it. But while you can't know who is carrying the virus, you should know that everyone who wears a mask has a reason to fight it. Whatever your reason, get behind the mask.
Take a moment to think about it. Why do you wear a mask? For me, I wear a mask to protect my family, friends, and coworkers, and out of respect for every North Carolinian who's working hard to do the same. I wear a mask because I know my personal actions make an impact slowing the virus here in North Carolina. These are the kinds of discussions we'll be spurring through this public awareness campaign, which will show up across the state this fall in many forms: TV, radio, YouTube, social media, your local billboard or bus stop. We'll be delivering the message about mask wearing to North Carolinians wherever they are. And just like our overall COVID response strategy, the Whatever Your Reason campaign has been made by North Carolina for North Carolina. We worked with local North Carolina photographers to document real people, places, and lives, reflecting the strength and diversity of our state. In the coming weeks, you could hear an ad on the radio, watch one on TV, or see it at a gas station or bus stop or convenience store. This rollout of the campaign has a very intentional focus on reaching our historically marginalized communities who are being most impacted by the pandemic. All PSAs and materials will be available in both English and Spanish, and will be continued to work with communities to bring these messages to the places and people that need this information the most. This includes members of our Latinx Hispanic community, which has experienced almost 4 in 10 cases statewide, despite making up about less than 10% of the population. It also includes members of our African American community, which represent just over 20% of North Carolina's population, but has experienced 30% of COVID deaths in the state since this pandemic has begun. And while these trends have been improving, these high levels of illness and mortality are not a pattern we're going to accept. There's something we're working on all fronts in terms of our response to this change. There's another group who have been our top priority as we work through this response, and that's North Carolinians who are uninsured. As we have worked over these 6 months to remove barriers for testing, we've faced the challenging fact that there are still far too many North Carolinians who don't have insurance. Yesterday, Governor Cooper announced a new program that leverages federal funding to cover 100% of the cost directly related to COVID testing for people without insurance. It's a good step to decrease barriers to testing, and this complements the work the state has already done to fund free testing sites across North Carolina. However, covering the cost of testing is not sufficient to help the uninsured. North Carolinians who don't have health insurance need the full range of care for COVID and access to needed preventive care. North Carolina needs to expand Medicaid like most other states have already done. I'm sure we're all looking forward to Labor Day weekend, and it's just a few days away. And I know many of us have our favorite traditions for this time between summer and fall, but this year it's important to make a plan in advance about how you and your loved ones are going to enjoy these 3 days in a safe way. Of course, the most effective way to do that is by practicing the 3 W's, wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. As a reminder, it's important to practice these preventive steps whenever you're around people who are not in your immediate household. That includes gatherings with extended family and close friends. Public health experts believe that Memorial Day weekend last spring likely accelerated viral spread in the U.S. because of unsafe large gatherings and travel. But now, months have passed and we've learned a lot from that experience. We have more and better information about how to protect ourselves. So let's all act on that. Remember, wear, wait, and wash. And whatever your reason, get behind the mask. And with that, I'll turn it over to Director Sprayberry.
Thank you, Madam Secretary. Good afternoon. Today is day 178 of the State Emergency Operations Center's COVID-19 response. We are continuing to aggressively push PPE to a variety of groups throughout the state. First, let me talk about this. Our thoughts and prayers are with those families recently impacted by the flooding in the central part of the state, particularly those that lost loved ones in floodwaters in Johnston County and Warren County. We also appreciate the valiant efforts of our first responders. Now to an update on our current disaster recovery operations. Recovery is underway after a tornado strike in Bertie County during Hurricane Isaias and the earthquake centered in Allegheny County. The U.S. Small Business Administration has granted disaster declarations for both of these events, making SBA low-interest disaster loans available to homeowners and businesses to assist in getting folks back on their feet. Governor Cooper has also signed Type 1 state disaster declarations for both the tornado and the earthquake events, making state-funded individual assistance available to those who do not qualify for an SBA loan. The Disaster Recovery Center in Windsor has been open since August 24th and closes later today. However, residents can still apply online for SBA assistance at disasterloan.sba.gov. The Disaster Recovery Center in Sparta opened this week and will be open through September 11th for residents to apply for assistance in person. In eastern North Carolina, the State Emergency Response Team is working to complete damage assessments for Hurricane Isaias impacts. Joint preliminary damage assessments are being completed with state and FEMA officials and will determine our ability to request a federal major disaster declaration for those areas. In Bertie County, 46 individuals from 17 families remain housed in hotels. Volunteers are working hard to connect and furnish travel trailers to house some of those tornado victims who need temporary housing solutions and need it quickly. Voluntary disaster relief organizations have been doing great work to support recovery operations throughout the state, and we thank those volunteers for their dedication and service. Regarding our outstanding volunteer partners, the COVID-19 pandemic has reduced the number of disaster volunteers available to work. These volunteer organizations need your help, especially if you're young and able. Visit the websites for groups like the American Red Cross, the Salvation Army, Baptist on Mission, Team Rubicon, and many others that are a part of the North Carolina Voluntary Organizations Active in Disaster at ncvoad.org. That's ncvoad.org to see how you can volunteer to help North Carolina communities recover. Our food banks continue to work overtime to address hunger during this pandemic. They desperately need volunteers to ensure we continue to feed North Carolinians in need. If you can't volunteer, please consider helping with a donation to support the food banks. Visit feedingthecarolinas.org to donate to a food bank near you. Your contribution will help put food on the tables for families that are struggling. We are now at the peak of hurricane season, and we are currently closely monitoring multiple areas of interest in the Atlantic and the tropics. While none of these systems pose an immediate threat to North Carolina, we know that forecasts can change quickly. We're asking that everyone remain aware and prepared, especially during this holiday weekend. If possible, make sure your family has a plan to stay with a family, with friends, or at a hotel if you have to evacuate due to a hurricane during the COVID-19 pandemic. Having a plan costs nothing, and every household should have a plan. The state will have non-congregate and congregate sheltering available, but it's best to stay away from shelters so you can minimize contact with others. Also, make sure your emergency kit is ready and includes the necessary items to stay healthy during COVID-19, such as face coverings and hand sanitizer. If you have questions about emergency planning, please visit readync.org for more information about plans, preparedness kits, and evacuations as a part of your Know Your Zone initiative. As Dr. Cohen shared, now is the time, whatever your reason, to get behind the mask. Wear, wait, and wash. This is how we slow the spread of the virus, working collectively together. We have the power. We urge you to rededicate yourselves to these actions over the upcoming Labor Day weekend. Let's keep everyone safe and healthy by being smart. Finally, a special shout out and a hearty hand salute to my battle buddy, Dr. Mandy Cohen. Today is Dr. Mandy Cohen Day at the State EOC, not only because she is the recipient of the Harvard T.H. Chan School of Public Health 2020 Leadership and Public Health Practice Award, but also because of her extraordinary leadership, expertise, and partnership. Congratulations, Madam Secretary. We appreciate you. And as always, don't forget to look out for your family, friends, and neighbors. Call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you. Thank you, ma'am.
Well, thank you. Thank you, Director. Now that I'm sufficiently embarrassed by Mandy Cohen Day here at the EOC, I want to remind our media partners that the PSA that we showed, as well as other products that we have, are a public asset, and they're available for your media outlets to use, and we hope that you do. So with that, I will take the first question.
Our first question today is from Lynn Bonner at the News and Observer.
Oh, thank you very much. Dr. Cohen, this is Lynn Bonner from the News and Observer. I've got a question for you about the CMS new rules for testing at nursing homes. Their new nursing home testing rules don't match the state requirements. So it looks like a lot of nursing homes are going to have to increase their testing frequency beyond once every 2 weeks. And I'm wondering how that's going to mesh with the state requirement. I'm assuming that the federal requirement is going to supersede the state. So how are the nursing homes going to pay for the extra tests, and how will adherence to the new testing requirement be determined?
Thanks, Lynn. A lot of questions within that and a lot of details. So for folks who haven't been following as closely, the federal government, through the Centers for Medicare and Medicaid Services, did issue a rule to nursing homes to do more frequent testing than even we are requiring at the state. For us at the state, we were requiring every other week testing of staff. They're requiring every week testing. They issued an emergency final rule on that went into effect immediately. It is enforced through what's called a survey and certification process. And so I know that nursing homes are working to increase that. As we announced several weeks back, the state has both paid for that first round of funding, and then we continue to have ongoing funding for nursing homes. It was meant to cover the every other week testing. Again, yes, these new federal rules are more accelerated than even our baseline rules. A couple things to help with that. We also know that the federal government has sent nursing homes certain testing devices as well as supplies. So that helps having the supplies right on hand. But that's just a few nursing homes that have really been able to get those supplies and testing instruments from the federal government. In addition, we expect the federal government to be shipping us additional antigen tests. Again, we don't know how much and when exactly, but the federal government has bought up all of the rapid Abbott tests that are the 5-minute antigen tests, with the expectation we will potentially use that to deploy to our nursing homes. So I think we have a number of ways in which we can assist nursing homes in trying to increase their testing, not only the funding that we're sending, but also through these instruments. And they will, yes, have to comply with the federal law. Thanks, Lynn.
We have a follow-up from Lynn at the News and Observer again.
So, Dr. Cohen, to get back on topic, about the public information campaign, we're now officially kind of 6 months into this pandemic, and I'm wondering why this campaign is getting going now. I mean, we're kind of deep into this at this point.
No, thanks, Lynn. Great question. And what I think is really important is that it takes ongoing vigilance with face coverings to make sure that we're continuing to keep viral spread low. So I think this is coming at the exact right moment, particularly as we're heading into our phase 2.5, few more things open, we're having Labor Day weekend. I think we need to continue to keep these messages up. We know we are asking folks to change behavior, right, and go to wearing face coverings and waiting 6 feet apart, and that's hard. And we're actually asking them to do it pretty quickly. And so I think this reinforces those messages and gets it out to even more folks. I know the folks who watch these press conferences every day and ask questions have been hearing me say the 3 W's, but we know that the message needs to get out far and wide, beyond what we can do from these press conferences. So I think this is a really great complement to what we've already been doing. I do want to thank the business community and others in the healthcare community who've been doing a lot of work on their own, promoting the 3 W's in different ways. Again, I think this all reinforces each other. And again, it's going to take that ongoing work. So I think this will propel us forward. I think it has a unique way of asking the question about, why are you wearing a mask? So I think it gets back to intent, which I think is really important for us to all recognize that we're working hard for each other. We all have different reasons to wear a mask, but at the end of the day, we're protecting each other. Thanks for that.
Our next question is from Rose Hoban at North Carolina Health News.
Hi, Secretary Cohen. It's Rose Hoban at NC Health News. Thanks for taking my question. So, for months, we heard you talking about that we were aiming at 5% positivity for tests. And here we are. We're going to phase 2.5, and we're really closer to like 7 and something. So, help talk me through the contradiction here between what you've been saying for a long time, and now you're making the choice to kind of go ahead and open up a little bit more, even though you hadn't reached your benchmark.
Thanks, Rose, for that. So a couple of things. First, remember that when we make decisions about moving forward, we look at a combination of metrics. So we don't look at any one metric. We look at our surveillance data, we look at our cases, we look at the percent positive, and we look at our hospitalization. And we also say, when we're looking at them, we want to look over a 14-day period, and we want to look for the fact, are they declining or are they leveling? And the one thing with percent positive is we've been pretty rock steady after a period of decline. So we were up closer to 8-9% positive, and then we have consistently floated down, and now we're bouncing around 6-7%. So we have declined, but we are holding steady a little higher than I want. And I think this is why we continue to say, as we reopen or we ease restrictions, we still have to be very careful. It's why we have taken a cautious step forward in just making this 2.5, and that we know that there are other things that continue to remain closed, like bars and other places. And I think that's exactly why. We don't see perfection in our metrics. We still know that our cases are too high. We know that our percent positive is higher than we want it to be. We still have work to do. It's exactly why we're launching the campaign that we're doing today, because even as we ease restrictions, we need to be vigilant and be doing those 3 W's. That is the thing that we really saw over the summer have our cases start to decline. So that's the work that we all need to do together, particularly as we start to head into flu season. I think we need to be even more vigilant and be doing the 3 W's all the time. Thanks.
We have a follow-up from Rose Hoban.
This is thank you for taking my follow-up. This is a completely separate question. Yesterday, the legislature was in town. The Senate passed House Bill 1105. And one of the things that I heard as a concern from a number of folks was about the congregate learning sites for children and the fact that they weren't going to be subject to the same types of regs as child care centers. The Senate declined to reimpose those regulations. So, what kind of plans do you have for reaching out and tracking what those organizations are going to be doing to sort of, at least come up to some minimum standards for childcare?
So first, I want to say, as a working mom myself, that I recognize that our working parents out there need options for childcare. But I want them to be childcare settings that are safe. And so, we have been working to put emergency rules in place so that community organizations like the Y can partner with schools to have childcare options for school-aged children. We've also stood up a hotline for parents who want to know what childcare might be available in their community. And so I'd encourage folks to try that hotline if you're still needing childcare. But I do think it's important to make sure that the folks who are caring for our kids have background checks, that someone on site knows how to do CPR, that they're required to report COVID cases to us. So I think those are core components, and I think with the legislation that was moving forward and is headed to the governor's desk is concerning. I think it was important, and I think we need to go back as a team and figure out how are we going to make sure that kids continue to be safe, even though that folks did not put in even some minimum requirements related to safety in those childcare settings. So I'd encourage parents to look for licensed childcare opportunities for their children. There are there. So go to the hotline and see what's available in your community. Thanks.
Our next question is from Lexi Wilson at WCNC TV, Charlotte.
Hi there, Lexi Wilson at WCNC Charlotte. Thanks for taking my question. My question is, we're talking about the 3 Ws. If people don't follow that over this holiday weekend, what are some potential consequences that our state could potentially see?
Well, thanks for that. It's so important as we go into this Labor Day weekend for folks to plan ahead. How are we going to celebrate this time, but making sure that we're doing it in the safest way possible? So how are folks going to plan to avoid large gatherings or to be wearing their face coverings? And remember, we want folks to wear face coverings when you're around anyone outside your immediate family. That means extended family, close family friends. You want to be wearing a face covering. And now, if folks don't do that, what we could be in store for is more viral spread. It's things that we saw back in June and July where our cases were going up and up and up, and we started to strain some of our capacity in our healthcare system. We never overwhelmed it, but we started to get tight, and I don't want to see that. I don't want to see what happened in other southern states over the summer where they really surged cases and they really maxed out all of their healthcare resources. That is not a place where we want to be. We want to make sure we have plenty of capacity in our healthcare system, not just to treat COVID, but the heart attacks or the car accidents or whatever someone may need the healthcare system for. So it's really important that we all work together, because what we are seeing is this can get away from us really quickly. We can see just from the example for at Chapel Hill how quickly you can go from very few cases to a number of clusters. I think it again reminds us of why it's so important to do those 3 Ws, to plan ahead for Labor Day, to really be cautious to avoid crowds and wearing a face mask. Thanks.
Our next question is from Liz Schlemmer, North Carolina Public Radio.
Hi, this is Liz Schlemmer from WUNC. Thanks for taking my question, which is about transparency around cases at colleges and universities. Many colleges have dashboards to publish data about their positive cases, but no 2 are alike, and some of them are really slim on the information that they're putting out to the public. In your opinion, do colleges have a responsibility to publish up-to-date data about cases, or what information do you think is most important for campuses to release for the sake of public health?
Thanks, Liz, for that question. As you know, at the state level, we've worked incredibly hard on data transparency and data quality, and it is very hard. And I think that's what universities are recognizing, that it is very hard to both respond to the outbreak, which you very much want to do the infection control, to make sure you're getting your students quarantined or isolated. That is job number 1, right? Because we want to control the infection. But then it's hard to both do that and then get the data reported, quality checked, and up each and every day. So what I would encourage our universities to do is to share best practices on how that's doing, how they could even rely on each other to help there. I do think there are some key things in terms of number of cases, tests that have been done, and I think most are posting on their dashboard. But and I'd encourage folks to continue that transparency. And in terms of making sure that we at the state as well have that visibility, folks should be working closely with their local health department. They can help both from the infection control, making sure there's enough testing availability, and then can work on making sure if there is needed work around data transparency as well. Thanks.
And our final question today is from Amber Rupinta with ABC 11.
Hi, Dr. Cohen. It's Amber Rupinta with ABC 11. Thank you for taking my question. My question has to do with the CDC letter that went out to state health officials last week to prep for a vaccine by November 1st, which, of course, is just 2 days before Election Day. I wondered if you could talk about how North Carolina is responding to that request, and can you address any concerns about the timing? Does it politicize a potential vaccine ahead of the election, and some question whether or not it's safe if it's being rushed?
Well, thanks, Amber, for that. I think vaccines are going to be an important tool here to help fight COVID. And it is going to be a big effort. So the planning does need to start now and has already started amongst my team and with our external stakeholders, thinking about both priority groups who would be first in line to get the vaccine, as well as how we do the distribution. A lot of complexities there. So work does need to go underway. And I think it's important to have plans in place. As far as timing, I think there's a lot of science left to still do. There are trials going on right now in North Carolina, phase 3 trials that aren't even fully enrolled. So I'd actually encourage folks who are interested to check out the vaccine trials that are going on here. They enroll a lot of folks in those to make sure that we understand how that vaccine would perform in older folks, in folks from different races and ethnicities. So we want to make sure we're getting a good understanding of how that vaccine is performing, both from a safety perspective as well as an efficacy perspective in lots of different groups. So I'd encourage folks in North Carolina to be part of those trials. But like I said, I think there's still a lot of science left to do, data for us to see before we are going to be moving forward with a vaccine. But like I said, I think it's right to start planning, and our teams have started planning. We're working closely with emergency management to make sure that we are ready whenever a vaccine will be available, but we'll have to be looking at that data first.
And we have a follow-up from Amber Rupinta.
Yeah, just to follow up to that. So could you also talk about how the distribution plan would be if and when the vaccine is made available, the phases of who would be receiving it?
Sure. Thanks, Amber. In terms of the distribution plan for a vaccine, I think those are the plans that are being developed right now. Our understanding from the federal government is that they are going to be working with a distributor. They will have vaccine centers where they'll be able to store these, and it will actually be distributed directly to providers, to doctors' offices or hospitals or the pharmacies. So that will happen directly. I think the state will be involved in making sure that goes successfully. We need things like deep freezers to make sure folks can keep those cold until they're ready to be used. So a lot of logistics involved. That is why I think it's right to do the planning now and then go from there. But like I said, I think a lot of science still to do and data to look at. So stay tuned. I think there's a lot more work we're going to learn about vaccines over the next number of months. Okay, with that, I want to thank you again for joining. And whatever your reason, make sure you're wearing a mask as we head into Labor Day. And thanks to those in the media for taking those PSAs and using them on all your media outlets. All right, thank you and happy Labor Day weekend.